We'd like to introduce or reintroduce Dr. Patrick Soon-Shong for a special announcement.
Thank you very much, Mr. President. I've been given this wonderful opportunity to announce the program that we're going to launch on this nation. And it's been a very busy week for me. I've been in JP Morgan, where the largest pharmaceutical companies in the world and the biotech companies in the world have gotten together. And one of the things that we announced that we can now measure cancer, believe it or not, from the blood. I know this sounds crazy, but it's possible now to actually capture cancer cells that's circulating 1 in a billion cells from the blood. The program that was funded by the Human Genome Project as a result of President Clinton has spawned not only the human genome, but now the cancer genome. When, in 2000, I was just saying to President Clinton, I watched his video where it was thought, by finding the book of life, the human genome, these 3 billion letters, we would actually sort out and cure cancer in the lifetime. Francis Collins says there was 2,000 people dying a day in America, and within his lifetime we drive it to 0, with the assumption that each DNA made the protein that actually caused the cell to grow. Unfortunately, that wasn't true. Each DNA made 200,000 RNAs, which made 10 million proteins, and the complexity was enormous. What's exciting, we've now solved that complexity, and we've gone from the genome to the proteome, and we can now measure the protein from a single cell from a slide of a cancer cell and compare it to the normal and tell us what's driving that protein, that cancer. We also, therefore, can now predict what drug you should be on, what drug you shouldn't be on. Should you be on cisplatin, these chemical poisons, or not? Is there an escape mechanism that's already sitting there that we can actually predict that you should be on it or should not be on it? This is the excitement of what we call the genome and proteome. And we want to announce today we will create a cancer collaborative. So in the audience, I'm happy to say that the members have come together, the largest cancer centers, MD Anderson, UCLA, John Wayne, City of Hope, have all come together to work together to actually create this for the nation. On the other hand, the private sector like Coca-Cola, Bank of America, Verizon have created the BPC Council. And in the audience are the unions, even, who we work with the employees and members who want to actually make sure that we not only have this just for the rich, but also for the working class of our country. So this announcement today is the partnership with the Clinton Health Foundation and Clinton Health Matters Initiative and our Family Foundation to create what we call the National Cancer Collaborative for this nation. This will lead, we believe, to Genomics America. In England, they've just launched Genomics England, where they're going to do 100,000 cancer patients in this way. And I was watching that video with Tony Blair and President Clinton announcing the human genome in the year 2000. The legacy continues when America and England and maybe Canada and China could combine its efforts to create a genomic world. So today this announcement is being made, and I'd like to acknowledge the people in the audience. Bill McDonough, who is the Executive Vice President, if he could stand up, of United Food and Commercial Union. He represents 1.3 million workers in North America. So Bill and I are working together to find opportunities to bring to the members of UFCW this finest healthcare that the working families could afford. We also have David Feinberg, the CEO of UCLA Health Systems, if he could stand up. And he is leading the innovation through his efforts to provide primary care options with the Taft-Hartley and welfare funds and developing ICOS within UCLA and to bring this near real-time care. Bob Myers, if he's in the audience, the CEO of Phoenix Children's Hospital, is leading this collaborative. He could stand up. And he's leading the collaborative effort for children's hospitals across the country. As you know, pediatrics are not well funded, so together with Bob Myers and Richard Cordova, we're going to link 7 major pediatric centers across the country and actually support this cancer care in pediatrics. we can't do this without the payment system. And as Sue said, the payment system will reach out to the for-profits. And Jim Hoffman, if he's in the audience from Bank of America, if you could stand up. And Jim and Brian Moynihan, the CEO, are visionaries, and they will be leading the charge with us in helping this together with Coca-Cola and Verizon. And I think Peter Tippett is probably in the audience from Verizon, and Lowell McAdam is a visionary, has actually taken this on, if he could also stand up. So this is an amazing, exciting initiative. Organizations like MD Anderson, University of Miami, City of Hope, as I said, are all going to be partners with this. And I've been really, really grateful for the real opportunity afforded me to have President Clinton act with us in voicing this change we can bring to this country. Thank you.